Rogers from Complete Care Animal Hospital here. Just wanted to give you a quick little intro on the video you're about to see. So we had a dog present to us for a second opinion for some coughing and gagging and things that her owners were noticing, and they thought honestly she might have something stuck in her throat, which is something that we commonly get a presentation for, and I'll be honest, it's very uncommon to actually have that happen. But the following video is really after we initially worked her up. We did do some blood work and we took some x-rays. We could actually see some irregularities in her esophagus on x-ray. So we ended up anesthetizing her and exploring that area. We went over all the options with owners, and the following video is basically what happened there. I hope you enjoy it. If you have any questions or anything, please feel free to leave some comments, and always we're open to suggestions. Obviously we're trying to grow our YouTube page. So if you wouldn't mind giving us a like or subscribe, that'd be great. And again, if you have anything you'd like to see or something you want some clarification on, please feel free to ask.
So we are going to anesthetize this girl. She has been coughing and hacking a little bit at home, and her mom thought she might have swallowed something and had something stuck in her esophagus. I'll be honest, oftentimes that's not the case. We have lots of owners that are concerned. We did take some x-rays, and this girl actually does have some suspicious material in the front part of the cranial part of her esophagus. So we're going to anesthetize her real quick and see if this is something we can get. We do not have an esophageal or an endoscope here. We're going to see if we can utilize it. If not, her owners understand that they may need to go on to a specialty hospital, but of course it's one of these 5:30 on a Friday night things, and so we're going to try to see if we can get this under control for her, see what we can find. Maybe we will find something, maybe not. Okay. Yes, we got an IV catheter. We're going to do a little bit of propofol. If you're sleepy, I know you're very excited. You're a very good girl, okay? Go night-nights, okay? That's what we find in here. Good girl. Good girl. Good girl. There you go. Good job. Good girl. Let's put her sternal, please. Oh, Julie, can you get me an endotracheal? This dog's airway here. Okay. So I actually see some string underneath this dog's tongue. This dog was super excitable and wobbly. So we've got string underneath here. We're going to see if we can pull this out gently. We may or may not be able to get this out of here, but this was caught underneath of her tongue. It's caused an ulcer, but I think this is what's hanging out. So we'll see what we can do. Okay, so we have an endotracheal tube in here now to control her airway. Again, this string was wrapped around her tongue, so we're going to see if we can slowly get this out. Well, here's probably what we were seeing in that esophagus on x-ray. There was a glob of material that was stuck in there. It was irritating. And there's some hair and some other material in here. So we're also gonna see if we can get back in there again. And God, I'm gonna untie this tube a little bit. Thank you, Rebecca. And we've also got our laryngoscope to see if we can find anything else. Kind of a weird angle. Doesn't look like there's anything else in there. Okay. Well, this, you can see it's better here, in the base of the tongue. This string was caught around the tongue, so she couldn't swallow it, and it was just irritating the bottom of her tongue. So we're going to recheck another x-ray here in a minute and see what we find, if anything, and go from there. Okay, so we're going to take an x-ray now of that area that was in question. See what we can find while she's still under anesthesia here. So we can see our endotracheal tube placement, which is actually perfect. flip this x-ray around. And this was the area where that was, and I certainly don't see anything now. This was the area of concern. So, okay. Well, looks like we've gotten it all. Hopefully now this girl will do well. There was a little suspicious area on her stomach with the previous film, so we're going to shoot that again just to see what we've got since she's asleep. Does have this in here. You can see that a little bit better. It looks like a little ball of something. So this she may or may not be able to pass on her own. So we'll talk to her owners about that. And I think at least at this point in time we're going to wake her up from this and see what it is that they want to do.
Just a little follow-up. I hope you enjoyed the video that you just saw. When we spoke to the owners several days afterward just to check in on our patient, make sure she was doing well. Her owners were thrilled. Her symptoms had completely resolved. No vomiting, eating great, running around, playing. So whatever was in her stomach has likely moved out, or it's not bothering her at this point in time. So we're very pleased that we had a very happy ending, a wonderful dog, wonderful parents. And so again, hope you enjoyed this video. If you have any questions or concerns or anything, please give us a comment down below and we'll try to get back to you. Have a great day.